Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm still in my PJs.
Well, that's good to know. Collectively,
4 o'clock in the afternoon.
Yeah, they're
somewhere.
Yep.
Collectively, we're the hosts of PodcastDX. On today's show, we're going to be talking about oral cancer.
Yes, Lita. And according to the World Health Organization, the WHO, there are approximately 650,000 new cases of oral cancer each year worldwide.
That's a lot.
Yeah.
It is a lot.
650,000.
Mm-hmm.
Wow.
Yeah.
I mean, when you think about it, they were complaining about, what do you call it? COVID. How many people are getting COVID? I mean, 650,000 a year, every year.
Okay.
Right.
Okay, I'm sorry. Back on screen.
Wow.
Okay, who's next? Me? Unfortunately,
Not a joking matter because you should be serious right now.
I'm sorry.
Okay.
Unfortunately, there are also 300,000 deaths from oral cancer every year. This is a terrible disease.
It is. And when you refer to oral cancer, or when we refer to oral cancer, we're actually talking about cancer of the lips, tongues, gums, other areas inside your mouth, your tonsils, your pharynx, and your nasopharynx area.
I don't know what some of those things are, but okay.
Like the back of your throat.
Oh, okay. In areas like Southeast Asia, oral cancer diagnoses outpace those of lung cancer.
Wow.
Didn't know that.
Yeah, right. And I guess tobacco and betel nut chewing, along with limited access to care, may be contributing factors in the high incidence in that area. After all, they are carcinogens.
Yeah, I heard betel nut is really bad.
Yeah, it's very bad for you.
From what I've read, most cases of oral cancer in that particular region are not diagnosed until they are in the late stage and the most difficult to treat.
Right. And there are a number of possible symptoms for oral cancer, including pain in the mouth, the throat, the tongue, the face, or when you swallow. Your teeth might become loose. You might have bad breath because you have ulcerations that don't heal and bacteria can gather there and cause a foul odor. You might have swollen lymph nodes. You might cough and not be able, and that cough doesn't go away. You might have sores on your lips, again, that don't heal, tongue or the lining of your mouth or your tonsils, also that don't heal. You might have ear or mouth pain. You might have lumps, bumps, or other areas of discoloration in the mouth. And oral cancer often presents as white or red patches, and they're usually bright red, or plaques, and these don't go away. And these patches or plaques, they might not be painful. So that's the problem. You might not realize there's an issue until it's too late because, you just let it go. You're like, oh, that's weird. But it's the not painful ones that you need to look for. And up to 75% of the erythroplakia, or the bright red plaques or patches, those are found to be cancerous. And so it really behooves you to check it out.
So bright red patches, the chances are that's not something good.
No. Yeah.
All right. Another reason to stick out your tongue.
Yeah.
Exactly. You can actually do a basic check at home while actually just looking in the mirror. If you have an area that you're concerned about, please make sure to point it out to your healthcare provider to see if it is anything or not.
Do you go to your dentist or your doctor?
Either.
I would.
Either?
One of them. How's that?
Yeah.
And then if there's an issue or they think it might be an issue, they'd probably, point you in the right direction.
Right. Okay. And we're not talking about a sore that you get occasionally from biting your tongue or biting your lip or a canker sore. Although repeated injury to the mouth can be a risk factor. So, in other words, if you bite your tongue a lot, that's a risk factor? Okay.
Or some people constantly chew on the inside of their cheek.
Oh.
But that hurts.
Yeah.
Not chewing on it, I'm just biting it.
Yeah. What about if people get what if people get piercings in their mouth? Is that a risk
It's not
factor?
repeated piercings.
Oh, I see. Okay. All right. So, if you're constantly chewing the inside of your cheek, have poorly fitting dentures, didn't think of that either, or other repeat damage, you should let your dentist know.
Yeah. That's
Okay.
absolutely. And early diagnosis is key here. Since you're unlikely to feel any pain when oral cancer is at its very early stages, it's vital to have a visual exam. And if you are in a high-risk group, if you use or have ever used tobacco products, chew or have ever chewed betel nut, drink alcohol, or have a family history of oral cancer, you may want to ensure that your healthcare provider, medical or dental, conducts a thorough oral cancer screening. And this is especially if you have any of the following symptoms or the previous symptoms that we had listed. And, like when you go to your doctor, they say, open your mouth, stick out your tongue.
Oh, yeah.
This is one of the reasons.
Gotcha.
They can tell a lot about your
right.
health
I didn't
by
realize
doing that.
Okay.
But it's such a quick exam. So if you have a concern, make sure you point out the area of concern and go to your, healthcare provider as soon as possible with that.
Right. And actually, since oral cancer can spread quickly, you're going to want to try and have it treated as soon as possible. If your healthcare provider sees an area or something that may be oral cancer, they probably will request a biopsy for you.
Right. And that means that they'll take a sample of the cells from the area and send it off to a laboratory for evaluation.
Right. From experience, I can tell you that waiting for biopsy results can be difficult. Not knowing and thinking the worst can weigh on a person, especially when it takes a week or two for you to get those results. It's best to keep to your regular routine when possible, so don't change up what you normally do. Distraction is good. Distract yourself with healthy activities, walking, spending time with your COVID bubble family, meditate, be creative, read a good book or the like. It's okay to feel anxious while waiting for your results. If, however, you find that you're unable to maintain your regular schedule, or you no longer find joy in doing something, find the stress is taking a toll, possibly, talk with someone. Please talk with someone. I think mental health care and counseling should be an integral part of biopsies because there is stress involved.
Mm-hmm.
And it's okay to get help coping during this time. We spend a lot of time learning how to do many things when we're growing up, but we don't always learn good coping strategies.
Right.
It's okay to talk with a mental health care provider. It can be helpful to bring someone, flipping the page, with you when you go to get your test results and write down any questions that you may have for your healthcare provider regarding your results.
Yeah, that's good advice because it can be overwhelming to hear something and you might not be listening after that, so they can listen for you and make sure that you get your questions answered.
Right.
Sometimes you may even need additional testing or biopsies, which may add to your wait for a diagnosis.
Which could be even more stressful.
Yep.
So the stages of oral cancer refer to the extent of the oral cancer and whether or not it is spread to other areas of your body. In these stages, they range from stage 1 through stage 4. There are some healthcare providers may even refer to the very, very early stage of oral cancer as stage 0, whereas stage 4 would typically refer to a large area of cancerous tissue and or that the cancer has spread to other areas of the body.
And your healthcare provider may decide to that oral cancer, it can be treated by the surgical removal of the cancerous tissue with radiation, chemotherapy, or there are additional treatments available. And your healthcare provider should discuss with you all of your treatment options and what to expect during the treatments, how the potential side effects of the treatments can be managed, and any concerns you may have, they should be able to answer those as well. It can be especially helpful to enlist the help, like we had said this earlier, of a mental health care provider and or religious counselor after receiving a cancer diagnosis.
That's good advice.
Mm-hmm.
There are some things that you could do to lower your risk of oral cancer. These include eating a well-balanced diet with lots of fruits and vegetables.
And if possible, don't use tobacco products or stop using them. Don't chew betel nut. Limit or eliminate your alcohol consumption.
And also, everyone should limit their exposure to sun and make sure you get regular medical and dental examinations. You may even want to ask for an oral cancer screening at your annual exam.
Sounds like good advice to me.
We try.
Yeah, I like that. Well, thank you for listening today. We hope that you enjoyed the show. If you happen to have a question or comment related to today's show, you can contact us at podcastdx@yahoo.com. We have a Facebook page, a website, podcastdx.com. We're on Twitter and Instagram and also Pinterest.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast. Thank you for listening.
Week.